Hello and welcome back to PA Truck Up. I'm your host Manny, and today we have Heather. Hi Heather, how are we doing?
Good. Thanks for having me.
It's all good. I feel like I should probably interview everyone at the PI this time. I'm slowly making my way through everyone.
I love it. I love it. Lots of great insight, lots of brilliant people under one roof.
I agree. And so the thing that I always find interesting, and I kind of touch on every episode that we do, it's like the collaborative space that you have there. Like it's not just like I'm the S&C coach, I'm the physio, I'm the nutritionist, I'm the AT or whatever. Like these are all working together.
We really do. And I think that is something that was that the initial critical component when we built the Performance Institute was I think every person that originally started at some point in their career had those siloed effect that was happening. It happens all across professional sports. And I think that was one of the critical components that we wanted to make sure didn't happen here. That it really was integrated. Everyday conversations are happening amongst our entire performance team. And it's so much better when you're getting those in-person communications, that nothing can be misstrued, and it's very easy to make changes on the fly to better an athlete when you have that open communication.
I agree. And I think when I last had on Olivia, she mentioned that the whole concussion protocol that he's currently flying through, like everyone has had a touch on that and like had their
Yep.
say in it, which is like it's awesome to see because like obviously concussions are very high, but like there's also different elements to a concussion that isn't just one way fixes everything.
Exactly. And I think that's how we approach everything across the Performance Institute, even when it comes to injury management, performance optimization, everything. There are so many inputs that come in that, allow us to be excellent at our jobs and give best in class care. And we need that input, right? Like so many people always say, like, an injury is the sports medicine team's priority. It is, but if nutrition isn't involved and they're not eating appropriately, if sports science isn't monitoring sleep and making sure all those critical components align, then I'm not going to get tissue optimization and get them back at a speed that I deem necessary to get them back into the octagon.
Yeah. Before we start the podcast, we should probably let everyone know who you are. So if you let us know who you are and the sort of background into how you got into this industry and how you got to where you are just now.
Yeah. My name is Dr. Heather Linden. I'm the Senior Director of Sports Medicine for the UFC Performance Institute. I've been here with the UFC Performance Institute for over 8 years. Previous to this, I was with Team USA. So I was based out of our Colorado Springs facility, where is really the hub for combat athletes. We had wrestling, both men and women. We had judo, taekwondo, boxing, gymnastics, all of this combat portfolio that really was kind of underneath my nose. And that got me into really loving combat sports. And I think having a unique understanding, which was not very common, especially 15, 20 years ago. So I think it kind of found my niche, and I absolutely love being a part of the combat sports. I think they're such a unique population. They challenge me every day and make me think outside of the box, especially as a healthcare provider. And, so here I am now at the Performance Institute. We have 3 facilities, one in Vegas, which I live in Vegas, but I also manage the sports medicine team in Mexico City as well as Shanghai.
Yeah. And what gets you fired up right now in terms of having obviously the one in the US, Vegas, Shanghai, and Mexico? Like, what fires Heather up?
I think the diversity of not only being a combat sport, but diversity of culture and understanding like every pathway for each and every individual is going to be unique and different. And that's really exciting for me because we can't just standardize putting a combat athlete in a box, right? They're not a quarterback that's going to look for, we need this upper body strength, this speed. Everybody is so unique. So it makes us have to be very creative in how we manage this population and pretty much take everything we've learned in the healthcare field, throw it up and say, how can we challenge those systems? So that's, I think, really what, excites me every day is I get to come in and, have a puzzle in front of me and it's very unique and I have to solve it. And I have great people that I get to work with every day to help solve those really complicated puzzles. And for me, that, grinds my gears and gets me really excited every day.
Nice. What's a current challenge that you're sort of trying to solve this puzzle for?
Yeah, I think the biggest challenge that I think I see day in and day out is really amongst that return to play, right? Like, this is a population that are independent contractors. They're not making a salary when they're not fighting. So, a normal return to play would have a timeline, based around tissue healing, based around, very fundamental profiles and data that they would collect in each phase of rehab. And unfortunately, sometimes it's not that easy for us because they might not be able to afford their, life, their home, their children, their wives, their car payments, things like that. So we have to bend and flex those return to play timelines and really push the boundaries. And I think that's something that's a challenge because when you're a healthcare provider, you want to put like health and wellness and do no harm, always first. And sometimes we have athletes that come in and will be like, yeah, I just tore one of my hamstring muscles off the bone, but I'm fighting in 4 weeks and I am going to do it whether you agree or disagree. And so then we have to become very solution oriented and take off that medical hat where we would say, you're never going to do this, and strategize on how do we get them there? How do we get them there safely? And how do we optimize performance, which is probably the hardest component between that health and performance.
That's a very interesting topic, and I would like if you could, obviously don't name anyone, but if you could give any examples on a situation where that has happened and what were some of your strategies to make sure that they stepped on that scale and then stepped onto that ring.
Yeah, I mean, I think I have one really good case study, and it's pretty unique. This athlete itself has, a bicep that's not completely attached, has a pec partial tear as well. And this athlete is top 10 in the world. And we've had both of these injuries we've had to manage that have occurred either within a fight camp or, right before a fight camp started. So both of these strategies, we have to look at how to protect the athlete from a health standpoint, like what other muscles can we strengthen around that area? How do we allow the tissue healing to occur? So using technology, we maybe have soft wave, also doing some objective testing to really, individualize that program. So let's say we know the pec and the bicep aren't at their optimal levels, but what other muscles can we improve on for that surrounding and capitalize so that they can function? Because we know that it's equally an upper body sport as well as a lower body sport, which is also something I think really unique to us is, they have to be powerful and strong. And I think our sports scientists say this well. They go from aerobic to anaerobic and flip back and forth throughout that entire time they're in the octagon. So we have to figure out, how to capitalize the most there. So when we're using strategy and doing our team meetings around this athlete and this injury, we have to say, okay, we still need to make weight, right? That's going to be a priority. They don't get paid unless they show up and make weight. So how do we do heat acclimation? How do we do heat making strategies and heat cutting strategies around the injury? We've had athletes, another example, with a lower body injury where they couldn't run and do things that they would normally do to make weight, where we had to come, get the team together and be like, okay, how can we put them on a bike in a heated tent, but keep the hydration so we don't dehydrate them too soon so they don't make weight. So there's so many moving pieces with all of our cases. And I think that's what makes it so exciting and unique is, we are sitting with the dietitians and saying, how can we get that weight to come down strategically without compromising that injury? We get together with our strength and conditioning team to say like, okay, I don't need you to use this body part, but you have all the other body parts, you have the spine, you have the trunk, to work around. How do we capitalize there? Let's take some objective measures and look at, internal versus external. Where do we need to put our focus and, really use objective information, clinical pearls and profiles to capitalize getting that athlete to the octagon and to the octagon safely, right? Like we've seen examples in UFC where maybe somebody didn't have a performance team around them and the injury quickly showed its head, at the beginning of the fight, and it's not the fight that we're looking for, right? We hate to see a fight end due to medical reasons or maybe a pre-existing injury that showed its head in the octagon. So being able to strategize with your entire performance team, your technical coaches, your strength and conditioning team, your sports psychologist, your dietitians, and your sports scientists, I think makes us very powerful.
Sorry, we are back. I had some technical issues there. You were saying that that's when you connect, well, when the athletes should consider their sports psychologists and every team around them.
Yeah, and I think like having that performance team is so foundationally a strength for our athletes because there are so many factors, right, that go into getting them safely in the octagon. I mean, people, like any other sport, when they have a bad day, it's a bad day, right? It's one of those things where it's just them as an individualized sport locked into the octagon. So we always have to capitalize and use the strengths of the entire performance team to make sure we're optimizing that performance for the athlete.
Yeah, I kind of want to go back
Yep.
a little bit. When you mentioned that the pecs and biceps, and you're kind of looking for
Yep.
how we can strengthen everything else around to make sure that they can at least still perform. Is that when you attack more the stabilizing muscles and the muscles like around it to make sure that they're strong enough to go for?
100%. I mean, this sport, yes, needs to be dynamic, but they have to have a foundation of stability. We see that especially in the shoulders because it is an overhead sport predominantly. We see, those instability injuries at the shoulder that have been there and sometimes have been there an entire athlete's career. So we focus a lot on that stability portion. We focus a lot on that rotator cuff, looking at like how to gain that proximal stability so that they can capitalize with their punches and things like that. So, when an athlete presents with, a pec tear, we're really focusing on that posterior shoulder, right? We're capitalizing on the technology we have to help try to speed up healing in the area of the injury, but then capitalizing on the strengths on those surrounding tissues. And we're really quick to partner with also the technical coaches to really guide them on what that athlete can still do because we know they're going to still want to train. So, how do we take out or mitigate anything that could maybe damage the injury that has occurred, but at the same time, setting them up for success still in that training? And I think that's the coolest thing about this sport. There's so many components of training, right? It's not just one sport, it's mixed martial arts. So we see a ton of sports coming into one. So knowing this sport and being able to guide those coaches so they can still do aspects of training even through an injury, I think is really critical as a sports medicine clinician.
Yeah. Another point you kind of touched on is the injury rates and weight management that happens with weight category based sports. With those specific cases, what are some of the considerations you're going through to mitigate that as much as possible? Obviously, nutrition is going to be down, so it again goes back to that tissue healing process. Yep. What are you doing that best prepares them to step into that octagon?
Yeah, so I think immediately when an injury occurs, we have a performance team that's doing a roundtable around that athlete, right? So critically, first, the dietitians are saying like, okay, what kind of tissue is injured? Let's make sure we supplement that tissue so we can be the most effective healing and have the best healing strategies. So we look at supplementation, we look at diet. We also know that there's that critical component of making weight that is occurring. We usually see the biggest descents that last 4 weeks into that performance, right? So we know things are starting to get cut out of their diet. We know that, they're still at a critical component of training because most of them do about an 8-week fight camp. So at that 4-week mark, halfway through, we know now the weight we're really looking for that weight descent, but we're also critically ramping up and staying strong when it comes to training. So it's a matter of all of us sitting around, and our dietitians will supplement any type of injury that we need. They will also prescribe the right nutrition or their diet that's going to stem and really aid in maybe a diet that supports reducing inflammation, or a diet that's really going to get protein to help heal a certain type of tissue. From there, we really map out what that descent looks like, and we might use passive strategies, right? Maybe we already know we're only going to get a fine amount of training before we're mitigating or possibly could re-injure that injury. So how do we get them to do that weight descent? So the team has strategies around active weight cutting versus passive weight cutting, and we might flex and change over to passive weight cutting during those strategies of those last 4 weeks to really make sure we're letting that injury heal and not, throw anything out there that might jeopardize that great healing process into the octagon. So it's a lot of minds coming together. And I think that's what I absolutely love about my job is you have brilliant people. We started with 6 performance team members, and now we're up almost close to 80. So now we have a ton of minds globally around the world that have seen a lot of things, have a lot of experience, and we get to put that together every day.
Yeah, that's a lot of people. That's a lot of
It is a
minds.
lot of people. It is. And, with a lot of people, yes, it's great minds and it's a lot of brilliant individuals, but trying to, ground everybody and get them on the same path can sometimes always be challenging. I think nobody talks about leadership and all of that stuff that has to be implemented. And, I have to give kudos to our VP, Dr. Duncan French, who really does a great job of managing the people that are on the ground to better aid and assist these athletes.
I was going to say, coaches and practitioners tend to be type A. And when you've got, you'll have at least 75 maybe type A's. You've got maybe 15% that isn't. Like that.
100%.
That's
It's managing
challenging.
people sometimes more than managing athletes, and that is very critical. That's why we try to get together facilities, get a lot of FaceTime in, right? Because we're very fortunate. The other 2 facilities we have are academy style, so more that developmental aspect where we can look like fine-tuned microscope of everything that's going on in this sport. And I think that's really where we get a lot of information that, pushes us to think a little bit outside of the box when it comes to the sport of MMA, of what we're learning about it, right? Where are these injuries occurring? Is there ways to mitigate these injuries? Is there ways to look at like what a developmental athlete look like compared to what is someone 5 to 10 years into the sport, right? We're seeing those big differences. And like, is there a way to change that path to give better career longevity within the sport?
This is a quick shout out to our main sponsor on this channel, TeamBuildr. TeamBuildr is all-in-one platform that hosts programs, questionnaires, testing, anything that you may need for your athlete's performance, you can host it in TeamBuildr. TeamBuildr also now has 2 different sides, which is OS and practice. For more information on TeamBuildr, check out the link in the description. And if you use code PACHOCKUP all together, you will get a 30-day free trial. Everyone else was so willing to pass me on and come back on to the podcast.
Yeah, I mean, I think we all want to just have that natural conversation that flows, right? And I think you do that really well. So kudos to you for finding that just natural conversation feel, because I think sometimes that's hard to do. And that takes a special person on the other side, that makes it feel more conversational and less questioning.
Yeah, so what I found is, and this is what I bring to each episode, is like, we're both human. We both just have different jobs. And if we're all in the same industry, obviously, but if I was to go across to your office, it wouldn't be like a fire round question. You would answer and then we'd move on. We'd dive into it a little bit, take different turns, have different opinions on things. So I was like, let's just take that and put it on this.
I love that. That's so good.
And like name dropping, I hate it because it's like, I don't want the views because of that.
Yes.
Like, I want the views to be like about what we're talking about, as opposed to, hey, we mentioned Kevin Hollander, let's fucking watch this episode. Sean Strickland was on, let's watch this episode. I don't really care.
I think that's something that I have always instilled really like a good value of mine is, one of the things I always say to students or people that are coming in to observe or shadow is like, this is their home environment, right? Like they are people just like we are people. So they're doing their own jobs and, they want to have a place where they can come, be naturally themselves, not always to have cameras in front of them. So I always say to like students, this is their home, treat it like that's their home.
Mhm.
And they are just like you and I, right? Yes, they might fight in an octagon and be a professional athlete, but at the same time, we're all made of the same components. We're all human beings and, appreciate that that's where they're coming from as well.
100%. I think that's so. I was in the US for a while. I was with the University of Washington
Yep.
at the football program. So
Okay.
like some of the kids I coached are now in the NFL, but like I saw them as like kids
Yes.
coming in, and I think the higher you manage to get in terms of like positional
Professions.
with your
Yeah.
athletes, yeah, tend to share this value because
Mm-hmm.
it's like they're just kids, they're just human. Like we've
Exactly.
seen them like breaking down, so it's not like
I mean, I think that my team and I probably see them at their most vulnerable time, right? Like the amount of information and knowledge that we gain from working one on one with them and really having that individualized time, I think we really get to understand who they are as humans, right?
Mm,
And I think that's such a critical component because, yes, they walk in an octagon, but you've also heard the stories that we've heard about, the anxiety or the stress being out there. I always kind of touch on this story when Cowboy Cerrone, he's very open and honest about, almost throwing up before he goes out there every time he fought. So you obviously see that human side and that human component. And I think it's really raw when you get to work with them, especially coming back from an injury, right? That's
mm,
when, they're wondering what is their outcome going to be? When am I going to return? When is my salary going to continue back up? There's so many factors. And I think that's a hard part being in a sports medicine that sometimes we forget how much stress and how much other extraneous factors that are going to impact their day-to-day rehabs.
yeah, I 100% agree. That's again, I think it's just the compassionate and the empathy slash soft
Yes.
skills that make us like this way. So like for me, yeah, I've always held these very strict um rules.
Yep.
Again, I'm doing this for me and the practitioners,
Yes.
not to get famous. If
Exactly.
if nothing ever comes from this podcast, I'm good.
As long as you've enjoyed doing what you do, right? Like that's how
Exactly.
I feel. Like we have a funny saying that one of my clinicians on staff said that we are just placeholders, right? Like
Mm,
this is one aspect of this athlete's life and if we can make any positive, outcome, then we've done a great job, right? Like, and I think that's really so critical that we continue as clinicians to understand this is one small snapshot in somebody's entire life. And we don't know what they've done prior to coming into this aspect of their life or what they're going to do even following this one spot in their life, right? And I think understanding that, they're very unique human beings, they're grinders, but in the end, they're really fun and they're really appreciative and they really value any bit of insight and tidbits that we can help to make their career better.
yeah, we will start the podcast again. This part will be cut out, so don't worry
Oh,
about that.
no worries.
Let me just take a timestamp. So I've got a couple of questions from what we've just spoken about, but it won't be on the topics that we spoke about. It'll be the same. It'll be the topics, but it won't be like the specifics of it, if that
Yep.
makes sense.
I love it.
We'll start in 5, 2, 1. So we're back. We had some technical difficulties again. And by technical difficulties, I mean my dog. But we were talking about recovery and the nutritional element of it. But that was kind of leading me to my third point and question on this. We hear a lot nowadays about like red light therapies,
Mhm.
ultrasounds, different waves of recovery. What is some of the modalities that you're using and what have you found to be most beneficial in healing that tissue and bringing them back healthier and safely?
Yeah. I mean, obviously, it's going to be very individualized driven, right? Like from a recovery standpoint. First and foremost, like let's just talk about coming out of a fight. We see a lot of soft tissue damage, right? Like my first time ever doing an evaluation on someone, I was convinced that pretty much every bone in their body was fractured after seeing them 24 to 48 hours. So it's amazing what the human body can do, but we see a lot of that superficial tissue damage. And with that, we really rely on our red light or our infrared laser bed to really help with that cellular regeneration, that ATP, and all of that to really improve that cellular damage. So we do use a lot of red light right afterwards. We use a lot of active recovery. We might use our underwater treadmill to have them walk and just get things moving. We use shockwave, which is going to be sound waves, and that stimulates growth hormone and stem cells in the body's natural tissues to improve healing. We will use manual soft tissue mobilization in order to kind of flush out some of that lymphatic system so that we can get good nutrients to the areas that need regeneration. And the team is constantly using different modalities. Sometimes we'll use blood flow restriction on a recovery protocol to kind of flush out the system, but we have everything from MSK ultrasound to neuromuscular e-stim to Tecker devices to shockwave to Ultra-Gs to underwater treadmills. We have steam rooms and saunas and cold tubs and hot tubs. So pretty much any modality that we can customize to that individual, we're going to utilize. We also know that, people are very unique. Some people adapt and respond really well to cold, others not so much. So we have to be able to adapt to the individual sitting in front of us and the tissue damage that we see uniquely to that one person after a fight.
Yeah. So I think the question I'm wanting to ask is, obviously there's a lot of people claiming that it's red light therapy, but it's actually just LED lights or light bulbs that don't specifically get the same requirements that we're talking about. Is there a certain way to test out if yours is the right thing to use or not?
Yeah, I mean, I would say, unfortunately, in this day and age, you can get anything by the tip of a finger, right? You can get on Amazon, you can get on any kind of website and get some of these recovery strategies. Now, the one thing that people don't always fully understand is everything that we use is going to be a medical grade, right? So you got to look at the waveforms and the wavelengths and everything like that to be a medical standard. So, if you are going online and going on Amazon and purchasing a red light device that's probably, very affordable, I would say it's probably not at that medical grade. For instance, our red light therapy was $75,000 to $100,000. Our, shockwave machine, sound wave machine is anywhere from $25,000 to $100,000, right? To get that medical grade technology, it is going to be, a medical
I see.
environment that houses it, right? So we do have to keep that in mind. Whenever you're purchasing any of these recovery modalities, because they do say that they're amazing online. They'll tell us, at this great quality, but usually a medical grade is going to be quite expensive and a little bit of a higher waveform or wavelength to get the adaptations that we look for.
Yeah. Jumping into something that we were talking about offline.
Mm-hmm.
When we're practitioners, we're sort of playing this role within their life as well, and we kind of don't know what will be afterwards. Can you sort of explain a little bit what you were talking about and how you see the impact that we have within each athlete that we come across?
Yeah, and I think, first and foremost, athletes are so unique. They're very individualized human beings, right? Bottom line, they're human beings. That's first and foremost. We always have to say that. But I think one of our clinicians has said things really well when she had said, we are a small placeholder in one snapshot moment of this athlete's life, whether it's injury based and they're coming for us for assistance, whether it's, someone to vent to speak to. But we never know what is happening prior to that dialogue or that conversation with that athlete or afterwards, right? Like you don't know what they've been through and you don't know what they're going to go through their entire journey and then where that end journey is going to be. So we try to really, when they walk into the Performance Institute, they are treated like every human being with utmost respect and really as an open ear for open dialogue to talk about anything that might help them. And I think so many times us clinicians think that we are maybe more important than we actually are. I think like, yes, we can assist them on a challenging situation, maybe where an injury occurs and getting them back to sport. But really and truly, it is all the hard work that they are doing. It is all the sacrifices that they are making as an athlete. And if we can just be a small stepping stone or a small support base for them, I think that's really integral and important when we're working with these high caliber athletes. And, don't forget that they're just like a human being, like you and I, right? They're going to have stresses, they're going to have things that happen in their life. And I think one great thing about being a service provider is that we're there to assist them in this small area of whatever they need. And I think that's probably the coolest thing about our job, but sometimes I think people forget that, there's a million other factors that are also going on in their life. Financially, are they in a good place? Are they in a good place in their life in general? Do they have a good support system and everything? And I think, we tend to be a great support system for them and realize that we're there for them individualized and not just in a group. And I think it's so critical to really understand all the moving components that go around athletics. And if we can come together and support them, then hopefully we can make their journey a little more successful and a little more healthy, and so that they can live the career and have the career that they've always wanted.
100%. And you kind of touched on the psychology, and I kind of want to say this before I ask a little bit about your role and the psychology element of it. But I think when you say like they are athletes and they have other things going on in their background, like I don't know for your exact specific story, but for mine, it's having your athlete come in, you noticing there's something off about them, and obviously you don't be like tell me everything, but like you kind of have to be like, it's like again what you're mentioning with the puzzles. You're kind of like, hey, what, you good? Did you eat today? Did you sleep well? Did you drink water? And they're like, yeah, everything's fine. It's like, okay. And then you get to the session and you notice that there's still a little something off. I'm like,
Something's
hey,
off. Yeah.
you don't need to tell me anything, but just know that if you do need to talk, I'm here. This specific case, he ended up telling me, hey, something going on with mom and dad.
Yeah, you nailed
Everything's
it.
good.
You nailed it. I will say this. I remember when a world champion, the week of his fight, had so much media and so much going on. And he called me and booked in. And of course, initially I was concerned maybe there was an injury that was, critical and that he was concerned about. We are 1 week out before him fighting a title. And I remember him coming into the session and me just asking, like, what's going on? Should we be concerned? What are we working on? And the athlete was like, honestly, Heather, I just want to sit on the table, and I know you're not going to ask me questions. I can just be my authentic self, and I can just have an hour with good conversation. I have no injuries, but I just need to get away and be out of the media and be able to really focus on my fight. And I know you'll let me do that if I book this hour. And I'm like, absolutely. I've also had times when an athlete was on the table and I could feel something was off, and they tell me an entire story of what's happening in their personal life, right? Maybe struggles with their significant other or an issue with one of their children at home. And you can see how that affects the rest of your day. Because, like, I remember a strength and conditioning coach coming to me and saying, like, gosh, like, we thought their numbers were going to be really good and they just were completely off today. Quickly, I was like, well, their girlfriend broke up with them, or, their kid is this. So you really get that, I think, raw component of being a human being when you're on the table with them, because it is just you and them, and you're able to help them, and they really can peel those layers away, and you can see that where you can assist them. And like, we're really lucky because we have sports psychologists and performance psychologists that are on our teams, where if someone's really having a hard time, we can refer them to the right person. But then we're always a sounding ear, right? Like, if someone comes into me and says, hey, I'm having a really bad day. I didn't sleep. I fought with my significant other all night. I can easily walk out to the strength and conditioning team and say, hey, I know this was going to be a high day for this guy. But let's just bring it down a little bit so that we can prevent injuries and not get this athlete injured. And, I can have that open conversation. Like, maybe today isn't the best day to spar. Like, maybe we need to fill that technical training component with something else, that if your mindset's not there, you haven't had breakfast, or you're not feeling 100%, maybe you're feeling a little ill. And I think that's something that we get to really understand each and every athlete and be able to guide what would be a better solution to handle that situation.
I love what you just said, and it kind of brings me to a story that we've previously heard on the podcast. Peter, he's a strength and conditioning coach in the Netherlands, and he does more sports, so he does a lot with Red Bull and all that stuff. Kind of to the point that you're saying, like, he doesn't mind being that asshole sometimes if it means that his athletes can be a little bit protected. His specific case was like, so he does Le Mans and all that stuff, the 24-hour races. Part of the athlete's job is to go up and speak to the sponsors, make sure that they're all good. But as soon as he knows that they're not wanting to be there, he'll come up and be like, hey, we need to go. And he'll be the asshole to the sponsors, but to protect the athlete.
100%. And I mean, I've seen that a lot when we go on the road, because my team goes to all 40 to 42 events out of the year. And I can't tell you how many times an athlete's like, I just booked an appointment because that's the only time I can tell the cameras or the embedded crew, like, hey, I have an injury. I don't want you around me. So they get that 1 hour back to themselves. And sometimes you just have to be that person for them, right? Like, you're definitely always looking out for them and figuring out how you can figure out their needs and how to make those needs happen. We talk about when an athlete goes to an event, right? Event week is extremely busy for this athlete. There is production pieces they have to do, there's filming, there's sponsorship pieces they have to do. So the entire week is really based on things that we need from the athlete. And I think it's so interesting when maybe other teammates or other people in the UFC are like, wow, that athlete is really grumpy this week. And to me, I'm like, oh no, they're wonderful, because I'm probably one of the few people besides our dietitians that are like, what can we do for you this week, right? It's not about what they do for us in the UFC. It's about what we can offer and assist with them. And I think that's why we definitely get to see that really raw side of the athlete and really the genuine aspect. And that's why I think, a lot of athletes feel, and we feel like we're part of the family, because we are there to support them in any way possible. And especially when it's the week of an event, when there's a lot of extraneous stressors and factors that play a part in what that outcome is for that athlete. So it's nice to be a sounding ear and just being someone there to support them.
Back to what I was originally going to input. Obviously, there's a huge psychological element to what you do when people get injured or are in the process of coming back. There's obviously that big, again, it's doubts, it's anxiousness, it's like all these horrible feelings into, can I go back into the same role that I was before this injury? How do you go around and help them manage that stressor?
Yeah, I think that's a huge factor that has to play a huge part of our rehabilitation with this combat athlete. Number one, we have to realize financially, it is a huge burden on them, right? So not only do we have the typical issues an athlete would say, am I going to make it back? Am I going to be as good as I was, right? When there's an injury, there's always that psychological component, that psychological readiness, if that athlete is going to be as good of an athlete after the injury. So first and foremost, we really do a great job as a team, surrounding that team with a support system that psychologically is there for them. We immediately also get our sports psychologist on board when there's major injuries to talk to, because we do realize that there's extraneous factors that are bigger than us, even affecting that return back to sport. So I think having that really good support system for this population is so critical, because we know that there's so much going into every injury. When this athlete, it's not like, this athlete walks into the octagon and has to out strength, out power, out smart. So there's a physicality, there's an emotional aspect that comes into making them successful as an athlete. So there's a lot of psychology that goes in and day out with this athlete population. And I can't tell you how many times athletes with injuries I've had break down, question what they're doing, and being that sounding ear and being able to completely support them, refer out if I need to, but at the same time also being a lending ear where I'm like, okay, I'm hearing you. Let's make, milestones that make you feel comfortable with your success, right? So having tangible items that athlete can meet their goals or their needs, having a timetable where their athletes like, oh wow, I've started hitting mitts already. So they can see those positive effects about the rehabilitation. And I think having those tangible goals, those objective measures to base their success on helps them get a clearer, return back to play. And that's really what we do. All of our return to plays have objective measures also around the psychology of it. Here's week 4. These are the goals I want you to have. We know that this athlete population is competitive. So if we have competitive goals for them to achieve along the different milestones of each return to play, I think that helps psychologically, get them in a better position.
Yeah. So are you trying to build confidence through specific injury movements to ensure that they can still go back to that same place or even better?
Yeah. So, I mean, you also have to think about this sport, right? So, a normal return to play, let's just say like an ACL on an athlete, they're looking to make like running milestones, jumping milestones, cutting, change of direction. For this athlete population, I'm going to say you have an opponent that's grabbing your leg. You're going to have to know great, dual tasking, proprioceptive feedback. You're going to have to get in a position that maybe your knee is, sitting underneath you, and you got to have the strength to get out of a position within a human body on top of it. So I think being really creative with our return to plays, not like your average return to plays. I mean, someone comes in and looks at the positions we get them in and out of, gives them that confidence that they can go back to sport. I've had, athletes carry a big aqua bag from the ground all the way up, or walk in a deep squat with a weighted vest. Ways to mimic what they're going to have to do, I think, gives them the confidence they need to get back in their sport. But that means as clinicians, we have to be super creative, adaptable, and really able to mimic, what the needs of a mixed martial artist are. So it's not going to be your normal return to play exercises that you would see typically. It's going to be being very creative, getting on the mats with the athlete, getting up into the octagon, or hitting bags and watching these athletes perform to be able to guide that return to play safely and as fast as possible.
Yeah, because obviously it's one sport, but there's a lot of sports within
Within
that,
it.
and
Yep.
everyone has their speciality. So when you are sort of creating these puzzles again and we're putting them together, what is that process like to be, hey, we know that he's jiu-jitsu heavy, he's got
Yep.
ACL, or we actually know that he's more like a kicking base, so we need to make sure his ankles, his hips snap through. How is that sort of moving pieces happening all at the
Yeah.
same time?
So I think first and foremost is we really try to get the technical coaches involved as soon as possible, right? Each one of our athletes is so unique, just like you mentioned. They might be more grappling heavy, they might be a more striker. So, first and foremost, the team has to really understand the sport. So, I mean, even uniquely this year, we made our own glossary of MMA terms that our coaches are using to
Nice.
instill that the terminology that the clinicians are using match what's on the ground, right? I can sit here and give you a bunch of limitations, but if I can't speak the language of what the coaches are looking for, they might not understand that. Second of all, getting those technical coaches involved as soon as we possibly can also assist, because they might give us insight saying, hey, he's more of a striker, or this injury is going to affect this fight. So whenever I'm looking at an athlete says to me after an injury or during an injury, do you think I can still fight? I am not the clinician that's going to be pulling you out of the fight unless it's a critical injury, life-threatening injury. But what I'm going to do, my first questions are, what is your game plan during this fight? Here's the injury and here's what your limitations are going to be. Let's say it's a lower extremity instability of the knee. I know that kicking mechanics are going to require a lot of stability, rotary, which sometimes lean on the ligament stability. What is your game plan in this fight? So getting that coach involved to say like, okay, can you use the tools effectively that you need to be able to win this fight? And if not, that's when I'm going to say, is it the right fight to take, in your career? But we're going to pull in, is there hype? I have a great example of an athlete who right now is one of the top athletes in the world who came to me probably 7 years ago after a ACL meniscus MRI that was positive for injury. This athlete still has not had surgery to this day. And I remember telling this athlete, okay, let's look at all the objective measures of what your lower body looks like. Now let's look at what do you need to do to function. I remember at the time his manager giving us input saying, he's at a critical part in his career because he has a lot of hype around him. The UFC loves him. He is somebody that they really want to build a superstar with. But if you take this athlete out for a year for an ACL meniscus repair surgery, we're not sure we'll be able to get that athlete back. So we had to strategize with all the coaches. We had to go to his technical training sessions. We had to really see, was he capable of doing what we needed him to do to win? And by taking all those factors in, we are now 7 years later. He's one of the top in the world, still competing without a surgical intervention of that lower extremity. And he's doing amazing. But that is so critical to take the components of the technical coach, the managers, the entire performance team, and blending that together to make the right decision for the athlete.
Yeah, I actually think I know which athlete you're talking about. And how is it managing that and still having them perform at such a high level?
Yeah, I think for us, we knew we had to build a lot of strength around the components of the injury, right? We had to make sure that he could function, he could get his range back comfortably, and then strengthen throughout that entire range because that was going to be required during his sport. And, he now does a lot of preventative work every day in his warm up. He has a certain program that he does to mitigate the risk. And then, constantly we're doing check-ins after fights. We're looking at objective measures to make sure, his peak torque to body weight is X, his range of motion is Y, his counter movement jump, his power and strength are these numbers, his ESD testing are these numbers. And by having things that start from a baseline or from pre-injury to post-injury, it gives us a lot of insight to where that athlete is and where we can support them, where those holes are.
Yeah. So a couple of episodes ago, we were speaking about it might not be, it might just be in a call that I was in. But when we get these athletes that are more broken than we can not necessarily fix, but like mitigate and prevent.
Yep.
Again, I don't think you can prevent anything. I think
I
the best
agree.
you can do is mitigate. Are you doing more maintenance work and making sure
We
that
are.
they're taking over as opposed to like trying to build specific? Yeah.
Yeah. So we do a ton of maintenance work, I would say, in this population because there are quite frequent injuries that occur. So I would say we are doing a lot of maintenance in day to day, making sure, one of the things that I still really hold close to my heart is like that manual hands-on evaluation skill sets, but also understanding what the
You need to
tissue and
feel.
the Yep, and what you feel. Because if you're not doing maintenance every day, I always laugh when other sports say to us, like, it's very hard to get maintenance treatment if I'm an NFL player because I only get 15 minutes a day of treatment unless I'm paying outside of my sport for additional work. And I always think, like, we expect these athletes to perform at an insane level constantly, right? Always trying to get bigger, stronger, more powerful. So just like a car, if we expect it to run and like be at its best, we do maintenance. So why are we so negatively impacted by saying doing maintenance care on a professional athlete? If we want them to constantly push the limit, then we should be assisting with maintenance just like we would in anything else. And that's something that I think the team does really well at the Performance Institute is stay up on those maintenance treatments that are required. When you are doing a wrestling practice, late afternoon on a Monday and you're doing a ton of clinch work and you're doing a ton of takedowns and snap downs, yes, your neck is not going to feel like it is brand new the next morning. So being able to walk into the Performance Institute, get some work done, work on that joint integrity and that joint mobility and the soft tissue structures that surround that area are so integral in that person having a positive next exercise session or next practice session. You know, we always say practice how you want to compete, but if your body's not at your optimal level when you're practicing, how do you expect it to be at the optimal level when you compete? So that is something that we do a lot here.
Yeah. And you kind of touched on it. In the S&C world, we have
Yep.
the coach's eye, but in your specific case, you've got the practitioner's feel. Do you think that art is being lost by some people?
I do. So it's so interesting because I think there's always the cyclical flow of what is so important right now. Everything is return to play metrics and, you know, almost that cross between strength and conditioning and sports medicine, where a lot of clinicians aren't putting their hands on people. They don't feel that there's a need. But I mean, I've been here before. When I'm 20 years in as a physical therapist, I've seen the sports world kind of go in this whole circular way, right? A lot of hands on initially, then it was no hands on, then back to hands on. Now it's no hands on again. But I do say, like, I have seen rehabilitations, even amongst my own team, that maybe didn't do the hands on initially. And I'm watching this athlete perform their corrective therapeutic exercises. And I'm just seeing that, you know, let's just say the lower extremity isn't moving in the best aspect. It is, you know, using compensatory strategies. It is maybe not getting into that end range that I would like to see or compared to the uninvolved side. So I quickly took that athlete out of the therapeutic exercise. I did some joint mobilizations, I did some release therapy, and then brought that athlete back in. And not only did the athlete, but also the clinician said to me, wow, that feels so much better and so different. So I think there's a middle ground where we need to be. I think we always try, I think, in this world to have the solution of everything, and that just doesn't exist. So I think matching that hands-on, matching that really good corrective exercises and blending that in the middle is really where we need to continue to stay. I don't think there's one answer on either side. I think meshing it really well gives you a better outcome and allows you to make a better difference. I mean, I had some students the other day, I was doing a shoulder rehabilitation, and this athlete said, you know, all I need to do is come in on a Monday, Heather. You can show me the exercises I need to do during that phase. And then I'm going to go back home to California for the next week, do those exercises. And then when it's time for the next set of exercises, we can do so. And I had that athlete in front of students and I had the students watching them. And I'm like, every exercise I'm giving him, he's not even utilizing the muscle that I'm actually trying to exercise. He is like using different strategies, whether it's from his pre-existing injury and then now the surgery. And I really put my hands on, gave a lot of manual and verbal cueing initially. Then I took that away and had that athlete really feel where that joint was in space. And he was able to mimic exactly what I wanted. And I said to him, you might not think what we're doing is important, but being able to cue you into the right positioning or making sure you're just doing it correctly makes or breaks a good rehab. And I said to the students, like, unfortunately, when you see clinicians on their phones, you know, reading why, you know, you have the athlete or even the general population exercising, they are doing such a disservice because a lot of times we have learned different movement strategies or compensatory movements that we just continue to go back towards. And unless we're making that correction, you're not really getting the results that you think you're getting.
Yeah. I'll say this. I'll tell you the full story at the end, but I sat in on a session of a team and the coach was more bothered about being on his laptop and the specific tests and the scores than watching the real session that was happening in front of him. And I was with some students and interns at that time, and they came out to me and was like, "What's your thoughts on that session?" I was like, "As practitioners, we need to be hands on. Like, we need to see everything that's happening." Because it's not just a safety thing, but it's that thing of you're not moving correctly. Let me
Yes.
check why. Let's see why. And then we can dive into further details of it. But it's exactly what you're saying. Like, you need, it's not that it feels pointless and it's overwork that we're doing, but it's making sure that everything runs as should.
100%. And I think right now we're at that spot in strength and conditioning and in sports medicine where we necessarily don't look at those small little components as much as we should be. I also would say that our population is quite difficult because they didn't come always from an athletic background,
Mm.
right? They didn't learn the fundamental movements in sports. And you can see that. But with that, we already know that they overtrain. We already know that a lot of times they're fighting through injuries, chronic injuries that they have. And we've learned that they can, compensate through those injuries and do quite well. But that eventually leads down to that tissue degeneration. And we see a lot of that, right? Like I constantly, I think, always bring up that we have a lot of labrum, a lot of
Hmm.
instability at the shoulder. But yet I see our athletes use a lot of back and bicep during training. But then I see strength and conditioning coaches using those as well. And I'm going, no, I just want you to focus on like some of the rotators, the smaller muscle groups. Yes, they're not sexy, they're not fun, they're not flashy on Instagram. But I see that shoulder, like I was looking at a case study. We had an athlete that had a minor rotator cuff tear initially in 2021, got a little worse in 2022. Now in 2025, I'm seeing slap tear, rotator cuff tear, like multiple pathologies
Mm.
now in the shoulder. And when I look at what this athlete has done, yes, they're not the best when it comes to like getting in and getting physical therapy. They're very much like grinded out kind of athlete. But I'm just screaming to say, can I have their strength team focus on these small integral parts, and maybe that like wear and tear over time wouldn't have happened so significantly
Mm.
if we looked at those small components that you just touched on that I think are so critical when we're looking at especially a population who is going to go for it all the time.
Yeah. What's the most impactful decision that you've made in your career?
Ooh, the most impactful decision. I think the biggest impactful decision I think I've made actually probably stems more from a leadership. Leadership was extremely hard for me. So I think what I've done that has been the most impactful is surround myself with people that are brilliant and being very open minded to being challenged in my systems and my
Mm.
processes and my day to day. We quickly don't want to be wrong. I feel like in society we're scared to admit when something's maybe not perfect. So I think the most impactful thing that I've done is like step away and try to integrate as a leader that you have a voice. The only way for the entire UFCPI to get better is to challenge the systems and everything we've done from day one to where we are now. So I hope that I foster that environment amongst my team and my teammates to really drive research, drive innovation, and really be adaptable when it comes to not only working with the rest of your performance team, but also with the integral athletes that come in front of us.
Yeah, I think you kind of mentioned this before, and you're talking about it just now again. It's that leadership piece. Obviously, being in physical therapy, it's usually, unless you're a big team, there's not a lot of you working together.
Yes.
Obviously, S&C is a little bit different because we are usually part of a team.
Yep.
How is that leadership and culture built around a system that's usually individual?
Yeah, I think the system is very individual, but I think one of the things I quickly learned, I think when you're a new grad, you want to be the person that everybody wants to ask for. Like, oh, they're really good at fixing things. I want to see Heather. I want to see, but you quickly realize there's only one of you, right? So you can't see every athlete out there. There is hundreds of thousands of athletes that are out there. So I think really what we've done here is open it up to build the team around you. I had an athlete this past week in Chicago text me and say, you know what, Heather, initially I was going to give you a bunch of shit for not being at a big pay-per-view event. And I have to tell you right now, the two team members that are here are phenomenal. You have done such a good job of training them and them understanding the sport that like I have to give you props that I didn't think it was possible, but to build a great team surrounding you, you really have done that. And they are crushing it this week on such a busy pay-per-view week with a lot of injuries and a lot of athletes on the card. And I think that was like Big Mama Bear feeling really, really good that, maybe I am impactful. Maybe, everything I preach does get down to the team, but really generating that team environment where we all can help each other, right? Something I see on an injury might not be the same as my colleague, and it could be something I miss or even be able to be better about. So throwing that ego aside, having your teammates assist you and have more brains and more power and more ideas that come across, I think just make us so much better as clinicians.
Yeah. And when you do have that team where you're sort of, I mean it this way, but I don't at the same time, like you're kind of cloning yourself and being adaptive. Obviously, people still have their interpretations of things. How do you foster that system where, hey, this is like what we plan and program, but hey, I actually also want to have your intake in it as well?
So I think that's a really cool, unique thing that we get to do because we do have clinicians that are globally, right? I have Australian trained physios from Italy, physios from America, physios from China, physios from Mexico. So one of the things that I've had to do is sit back and say, okay, we all have our own strategies and how to get where. Let's collaboratively develop the PI strategies. So like these are what objective marks we want to hit. Now, how you get to those objective marks, I'm going to give you all the autonomy you want. As long as those objective marks are being made and we have all agreed on what those objective marks look like across the board and what is unique to the PI, then I'm going to give you the freedom to get there however you want. And I think that gives you a big platform to have great open communication with your team, because if for some reason those people aren't making those, objective marks that you have set as a standard for your team, then that opens up a really good dialogue. Like, what do we think happened? What can we do better? Right. And there's no right answer because we know like an athlete can come in post-surgical and gosh, be rainbows and butterflies. And the next one can come in and we're like, something is off, right? So I think, there is no right answer as long as you guys are all getting there and developing a standard that meets what you guys want to be proud about and what you want to stand for when you challenge systems and other places when it comes to performance.
Yeah. What's one piece of advice that you'd give new PTs or people wanting to become a PT?
The biggest thing I would say is throw egos at the door and learn as much as you possibly can, right? Like, don't run down one rabbit hole of only understanding this type of technique or philosophy, right? Because I will say every athlete's different and maybe this philosophy works for somebody but not always. So like open up, your mindset and really be a sponge, right? Take it all in, learn all the different philosophies and strategies, develop your own that's unique to yourself, and then be open-minded when people maybe challenge those philosophies and strategies to continue to adapt. And, you will never know anything. I still learn from all of my after 20 years of being a clinician, I probably learn every single week something from my team. And I think as long as you can sit here and say you're learning, you're only going to better yourself.
I think so. I've got this saying that I've been saying a lot recently, and it's like the more I speak to people and like the more I read and learn, the less I actually know. Because like there's so much going on all at the same time that like it's physically impossible to keep up with everything. But
Don't
like
be
you
the
can speak
smartest
to
in the
people.
room, right?
Yeah.
Don't be the smartest. Surround yourself with brilliant people and continue to surround yourself with brilliant people.
Yeah, and again, that's why I love this podcast so much, is because like I'm in a fortunate position where I could have people like you, people like Brian Mann is coming on soon,
Yeah.
so like really big players in this industry. Like to me, I still feel like I'm a student every single time I press record, and that's
I love it.
exciting.
That is so exciting. That's such a great job. And I feel like you're in a very similar place as me. You get to meet exciting people, you get to learn, and it's just a journey within itself.
Heather, I appreciate you so much for coming on today. I kind of know you're a little bit pushed for time, so it was nice having you. If you can let everyone know where they can sort of get in contact with you or ask any questions?
Yeah, I mean, all of my social media is my first and last name, so it's all Heather Linden. And if there's any questions, I have LinkedIn at Heather Linden, and you can find me on any of these. So excited to be a part of this podcast today and have really good dialogue and conversation with you. So thanks for having me.
Appreciate you. Thank you. Peace.
You're welcome.
Okay, before we head off, can I ask you a couple questions? So I'm trying to build out something that interns and students can get access to that helps them really make the right step into this industry, whether it's S&C, PT, doctor of ATs, and everything else.